Today we're going to learn about diabetes and pregnancy. But first off, congratulations. Whether you've had multiple pregnancies or this is your first, it is really a time to celebrate. Today, you're going to learn about how diabetes and pregnancy and what impact it has on you and your growing baby. So when a woman becomes pregnant, pregnancy hormones are created by the body to support pregnancy. These pregnancy hormones naturally create insulin resistance to ensure that the baby gets all the nutrients needed to grow. This means that a pregnant woman's body struggles to keep glucose, which is a type of sugar, which is also our body's energy, from getting to the baby. This graph here will show you the trend of insulin resistance that occurs during pregnancy. You can see that the bottom line shows different points in time. The dashed line, which is blue there, shows how a woman's body without difficulties can meet the insulin demands. You can see that insulin needs increase and peak into the third trimester, which starts around 28 weeks. Now, if you look at the solid orange line, it shows the insulin deficiency that a woman can have with diabetes. This gap becomes more apparent the further along you are. This isn't a bad thing, but when a baby gets too much glucose, it can increase the risk for birth defects. Larger babies, early labor, low blood sugar, and potential difficulties with breathing for your baby after it's born. This is why it's important to test and treat pregnant women for diabetes. Whether a woman is already a diabetic before they're pregnant or diagnosed while pregnant, it will have a significant impact on the development and growth of a baby if not well managed. If you are diagnosed as a diabetic during your pregnancy, you may ask yourself, how did this happen to you? Many factors influence your risk, like being overweight, over the age of 25, having a strong family history of diabetes, from certain ethnic groups like American Indian, Alaskan Natives, African Americans, Hispanics, and Asian Americans. Also having a history of polycystic ovarian syndrome, also known as PCOS, or not being very physically active. Other women affected are those who have had a previous pregnancy where the baby was close to 9 pounds or more. What does diabetes mean to a developing fetus? If you have your hemoglobin A1C blood test drawn early in pregnancy, it is best to keep your A1C at or below 6%. This blood test looks to see how well your body manages glucose. The higher the number, the poorer the control. Elevated A1Cs in the first trimester can increase the risk for birth defects. Your A1C should be checked at least every trimester by your primary OB. Elevated blood glucose readings can increase the risk for larger babies, which in turn can increase the risk for shoulder or abdominal dystocia. That's where a baby has difficulties coming through the birth canal. Another concern is that if the baby gets too much glucose, it increases their urine output, which increases the amount of amniotic fluid around the baby. This extra fluid can put the baby at risk for cord injuries or increase in the contractions and for a risk of preterm labor. Poor glycemic control can also affect how well a baby can breathe or manage their blood sugars after delivery. By having good management over your blood glucose readings can help baby stay safe and out of the NICU. So diabetes in pregnancy really is not easy. It's not just about checking or changing your diet just once, since both your baby and placenta continue to grow the entire time. You will find that you will need to continue to tweak your diet and any diabetic medications to better manage your diabetes. Where do you start? This is where the high-risk obstetric providers at Upstate Maternal Fetal Medicine can help. Our role is to educate, evaluate, and manage your diabetes. We strongly encourage you to attend a one-time diet class that focuses on nutrition and pregnancy that your primary OB can refer you to. It gives you a foundation of knowledge to build from. Depending on how far along you are in pregnancy, we take into account your glucose readings, baby's growth, and amniotic fluid levels when developing your plan of care.